more than 1.3 billion people could be living with diabetes by 2050, and it's being made worse by inequality.
100.9, so hitting on sepsis.
Yeah, she's good. She's.
I think there's just less emphasis on nutrition.
In conventional medicine, the message to diabetics has always been clear. Avoid sugar, avoid carbohydrates, avoid anything that raises blood glucose.
Relatively uncommon in New Zealand. I now have patients with type 2 diabetes who are pre-teenage.
Dr. Diaa Al-Awadhi looked at that message and disagreed. Not partially, fundamentally. He argued that sugar is not the enemy of the diabetic, that the body produces sugar on its own, regardless of what you eat, that insulin is not what most people think it is, and that the entire framework used to understand and treat diabetes may be built on an incomplete picture.
Burden of diabetes, it's not just the number, but it's the things that diabetes can bring with it.
These are extraordinary claims, and they deserve serious examination. This is video 2, the most controversial part of this series. In this video, we examine his theory on diabetes in full. We look at the testimonials. We hear from the doctors who called it dangerous.
Amputation, blindness, kidney failure.
And we ask the question that matters most. Is there any science behind this or not?
I don't know.
You don't have to be on dialysis?
I don't know.
To understand why Dr. Diaa's ideas are so controversial, you first need to understand what conventional medicine says about diabetes and why it says it. The pancreas produces insulin. Insulin acts as a key, unlocking cells so glucose can enter and be used as energy. In type 1 diabetes, the immune system destroys the insulin-producing cells. The pancreas produces little or no insulin, and without insulin, glucose cannot enter the cells. It builds up in the blood, and the body starves at the cellular level. Daily insulin injections are not optional, they are life-sustaining. In type 2 diabetes, the body still produces insulin, but the cells become resistant to it. The key no longer fits the lock properly. Blood sugar rises, and over time, the pancreas weakens further. Treatment involves lifestyle changes, oral medications, and in many cases, insulin. This is the model taught in every medical school, supported by decades of clinical research, and used to treat hundreds of millions of people worldwide. Dr. Diaa looked at this model and argued that it was incomplete. Not entirely wrong, but missing something fundamental. Something that changes everything. The first and most important point in Dr. Diaa's diabetes theory: blood sugar does not come only from food. The body manufactures glucose internally, and it does so constantly, especially during 3 specific states: fasting, physical exercise, and psychological stress. During fasting, the liver breaks down stored glycogen and releases glucose into the bloodstream. During exercise, muscles demand fuel and the liver responds. During stress, cortisol signals the liver to produce extra sugar as a survival preparation, a threat response, built into human biology since the beginning. This means a diabetic can wake up with high blood sugar after a full night of fasting, not because they ate something, but because their liver produced it, overnight while they slept. Dr. Diaa argued that this single fact, the body's ability to manufacture its own glucose, fundamentally changes how we should interpret elevated blood sugar readings and how we should respond to them. In his model, the liver is not a passive organ. It is an active glucose manufacturer. It produces sugar from 3 internal sources: amino acids from protein breakdown, glycerol from fat breakdown, and organic acids from internal metabolic processes. This process is called gluconeogenesis, and it is not controversial. It is established biology. The liver produces glucose. Every human liver, every day, regardless of diet. Where Dr. Diaa diverged from convention was in how much weight he gave this process. He argued that in many cases of elevated blood sugar, the liver's internal production is a far more significant factor than the sugar consumed in food, and that treating the symptom, the high reading, without addressing the underlying trigger, the liver's overproduction, is treating the alarm, not the fire. This is one of the most clinically relevant points in Dr. Diaa's entire framework, and it is one that even conventional medicine acknowledges, though it is rarely emphasized to patients. Any significant psychological stress, an argument, anxiety, fear, grief, triggers the release of cortisol. Cortisol signals the liver, produce glucose now. We may need to fight or run. The liver responds, blood sugar rises, no food required. This is why many diabetics report their highest readings on their most stressful days, even when they followed their diet perfectly. The sugar was not from food. It was manufactured by the body as a survival response. And Dr. Diaa argued that punishing the patient for that reading or increasing their medication because of it is a fundamental misreading of what the body is doing. Now we come to the most controversial part of his theory: his reinterpretation of insulin itself. Conventional medicine says insulin is the key that unlocks cells for glucose. Without insulin, glucose cannot enter cells. Therefore, diabetics need insulin. Dr. Diaa said, that is not the complete picture. His argument was built on one biological fact. Most cells in the human body do not require insulin to absorb glucose. They have their own glucose transporters, known as GLUT transporters, that allow glucose to enter independently. The brain, red blood cells, the kidneys, the liver itself. None of these require insulin to use glucose. Insulin, in his model, is not the gateway. It is an additional door, a storage mechanism. Its primary function is to take excess glucose and convert it into fat and starch, storing it in the liver, muscles, and adipose tissue. It is a hormone of abundance, a hormone that says, we have more than we need right now. Store the rest. Dr. Diaa used one specific lab marker to support his argument about insulin and glucose: the HbA1c, the glycated hemoglobin test. The test used to measure average blood sugar over the previous 2 to 3 months.
We have built into the factor that once we test people and they have these high levels.
His argument was this: HbA1c measures glucose that is bonded to hemoglobin inside red blood cells. Red blood cells have no insulin receptors. They absorb glucose entirely without insulin. And yet, glucose enters them, bonds with them, and is measured in the HbA1c test. To Dr. Diaa, this was evidence that glucose moves into cells independently of insulin, that the conventional model of insulin as the essential gateway was, at minimum, incomplete, and that the implications for how we treat diabetes needed to be reconsidered. These interpretations differ significantly from mainstream medical consensus. The role of insulin in glucose metabolism is well established in clinical science.
This section presents Dr. Diaa's perspective for documentary purposes only.
Now, the question most people ask first: if this system is designed to help people with metabolic conditions, why does it allow sugar? Why does it allow fruits? Why does it allow honey and chocolate? The answer lies in everything we have just covered. In Dr. Diaa's framework, glucose is not a poison. It is the primary fuel of the human body, particularly for the brain. The brain consumes more glucose than any other organ. It cannot run on fat alone. It cannot run on protein alone. It needs glucose, constantly. And the body knows this, which is why it manufactures glucose internally even when you eat nothing at all. His argument: if the body produces sugar on its own to survive, then sugar itself is not the problem. The problem is the system that processes it, the timing, the frequency, the hormonal environment, and the other inputs that disrupt the body's ability to manage glucose naturally. Dr. Diaa pointed to a specific pattern he believed was far more damaging than sugar alone: the combination of sugar with foods that trigger excessive histamine and insulin responses. Eggs, chicken, yogurt, white flour. These, in his model, create a hormonal environment that prevents the body from processing anything efficiently, including glucose. Remove those inputs, and the body's ability to manage sugar may improve significantly. This is why fruits are allowed. This is why honey is allowed. This is why chocolate, in its non-dark form, is allowed. Not because sugar is harmless in all contexts, but because within the structure of this system, with the forbidden foods removed, the body is in a better position to handle natural sugars the way it was designed to.
Well, I'm a farm girl. I know what good meals are.
At this point, a critical clarification. The Tayebaat system does not tell diabetics to stop their medication. It does not promise a cure. What it suggests is this: follow the dietary system, monitor your blood sugar carefully, and follow up with your doctor regularly. If your readings improve over time, your doctor may choose to adjust your medication accordingly. But that decision belongs to your doctor, not to a diet, not to a video, and not to anyone other than your qualified medical professional.
And how you feel?
A lot lighter.
Lighter.
No more bloated.
No more bloated. الطيبات system.
I feel like I think I'm in shock a little bit.
It's pretty exciting.
Beyond the theory, there are the people. Thousands of followers across the Arab world who adopted the Tayebaat system and reported significant changes in their health. The conditions most commonly reported to improve include type 2 diabetes, gastroesophageal reflux, irritable bowel syndrome, H. pylori, sleep disorders and insomnia, psoriasis, urinary tract infections, polycystic ovary syndrome, and in some cases, patients who were also undergoing conventional cancer treatment reported improvements in their overall condition.
Knows that I went through cancer during this past period. Since I started following Dr. Diaa's regimen, now I'm in my 3rd week, and I swear, I'm not lying. My bones don't hurt anymore. I can bend my knee now. The knee pain is gone. My back, the spot between my ribs that used to hurt, it felt like there was a stone placed in my back. I can't describe it.
After adopting the dietary system alongside their medical care. These are personal accounts. They are not clinical trials. They cannot be used to prove that the system works for everyone or for anyone in particular. But they cannot simply be dismissed either. Because behind every account, there is a real person with a real experience that deserves to be heard.
I used to have eggs, milk, and fava beans for breakfast, but I stopped all of that, including before going to bed. The result within 7 days was that I started sleeping very deeply and very well.
Until I tried the diet, or the Tayebaat system, the chronic pain I had suffered from for 15 long years in my lower back had completely and suddenly vanished.
What we can say with confidence is this. Many of the improvements reported by followers are consistent with what happens when anyone on any system eliminates ultra-processed foods, reduces eating frequency, incorporates intermittent fasting, and pays close attention to what they consume. Whether the specific food classifications of the Tayebaat system are the reason for those improvements, or whether it is the broader lifestyle shift, is a question that only properly designed clinical research could answer. And that research has not yet been done.
And if something goes wrong, you're already well along.
Now the other side. And this side deserves equal time, equal respect, and equal honesty. A number of physicians and nutrition specialists have raised serious and legitimate concerns about the Tayebaat system. We present these not to discredit the system, but because you deserve the full picture. The most fundamental criticism is this. The Tayebaat system has never been tested in a controlled clinical trial. There are no peer-reviewed studies, no randomized controlled research, no long-term safety data. Without this, it is impossible to confirm whether improvements attributed to the system are caused by the diet itself, by the elimination of ultra-processed foods, by the placebo effect, or by other lifestyle changes made simultaneously. In medicine, personal accounts, however compelling, are not evidence. They are a starting point for research, and that research has not happened. Many nutrition specialists have raised serious concerns about the nutritional completeness of the system. Eggs, dairy, legumes, and most vegetables, all forbidden, are among the most complete and affordable sources of protein, vitamin B12, iron, calcium, fiber, and a wide range of essential micronutrients. Eliminating all of them simultaneously without medical supervision and supplementation carries a real risk of deficiency, particularly for children, pregnant women, the elderly, and anyone with an already compromised nutritional status. Dr. Ahmad Abdul Malak, a Kuwaiti family physician, raised a pointed observation. The system permits Nutella, chips, packaged juices, and processed cheese, all ultra-processed products, while banning eggs, dairy, and vegetables among the most nutritious foods available. He argued that this contradiction undermines the system's internal logic, and that no credible nutritional framework can simultaneously condemn eggs and endorse Nutella.
Those who ban some leafy vegetables, and with the claim that they're just for animals. No, that's wrong. Leafy vegetables or green foods are actually beneficial. Banning milk or all dairy products, and that's a nutritional risk. Completely banning eggs is also a very big nutritional mistake.
Perhaps the most serious concern raised by critics is the risk that followers may use the system as a reason to stop their medication, particularly insulin. For a type 1 diabetic, stopping insulin is not a lifestyle choice. It is a medical emergency. The body cannot produce insulin. Without it, blood sugar rises to dangerous levels. Diabetic ketoacidosis can develop within hours. It can be fatal. Critics warned that any system that creates the impression, even indirectly, that medication can be replaced by diet is putting vulnerable people at serious risk. The rule to drink water only when thirsty and to avoid what the system calls overloading contradicts the guidelines of major health organizations, including the World Health Organization. Adequate hydration is essential for kidney function, blood pressure regulation, cellular health, and metabolic processes. The thirst mechanism alone, particularly in older adults and in hot climates, is not a reliable indicator of hydration needs. And for diabetics specifically, dehydration can significantly worsen blood sugar control. Egyptian physician Dr. Walid Shawki has been among the most vocal critics of the system. He has publicly stated, and repeatedly, that the Tayebaat diet is dangerous and potentially fatal. His argument? Eliminating eggs, dairy, legumes, raw vegetables, and poultry simultaneously can cause severe nutritional deficiencies, weaken the immune system, and is especially dangerous for people with chronic illnesses who follow it as a substitute for medical treatment. He has called for health authorities to investigate the system's widespread promotion. He also made a point worth highlighting. The correct principle is not blanket elimination, it is personalization. Each person should identify, ideally with their doctor, the specific foods that do not suit their own body, and cut only those. If milk causes you a problem, cut milk. If gluten causes you a problem, cut gluten. But eliminating entire food groups because some people have intolerances to them is not medicine. It is a template imposed on everyone, regardless of individual biology.
And you eat huge amounts of sugar from things like Nutella. I have said it repeatedly. I have consistently and repeatedly said that this specific system carries the very real risk of sudden death.
In 2026, the Egyptian medical syndicate took formal action. Dr. Diaa Al-Awadhi's name was struck from their register. His license to practice medicine was revoked. The official position? His recommendations posed a risk to public health, particularly his views on medication and chronic disease management. Dr. Diaa continued his work. He continued publishing. He continued consulting. And his following continued to grow, until April 17, 2026, when he was found dead in Dubai at the age of 47. That story in full is video 3. So where does this leave us? The Tayebaat system presents a genuinely different way of thinking about food, metabolism, and chronic disease. Some of its ideas, like the role of stress in blood sugar, the liver's glucose production, and the importance of eating frequency, are grounded in established biology. Others, like the specific food classifications, the histamine theory, and the reinterpretation of insulin, remain outside the mainstream and have not been validated by clinical research. The testimonials are real. The people are real. The improvements they report are real. But real experiences, however powerful, are not the same as scientific proof, and the difference matters, especially when the stakes involve chronic disease, medication, and vulnerable populations. What we can say with confidence, if you are healthy and curious, exploring a dietary system under medical supervision is a reasonable personal choice. If you have a chronic condition, particularly diabetes, no dietary change should happen without your doctor's knowledge and guidance. And no medication should ever be stopped based on a video, a website, or a diet system. Ever. The Tayebaat system may help some people. It may not help others. It may carry risks for specific populations, and it deserves, at minimum, the serious scientific investigation that has not yet been conducted. In this video, we examined the ideas, the theory, the science, the criticism, but we have not yet told you about the man behind all of it. Who was Dr. Diaa Al-Awadhi really? How did a professor of anesthesia become one of the most followed and most controversial health voices in the Arab world? What led to the revocation of his license? What happened in Dubai? And what does his story tell us about the relationship between medicine, power, and the people who dare to ask different questions? Video 3, coming soon. All information in this video is sourced from the official Tayebaat System platforms and publicly available medical commentary. We encourage you to visit both websites, read the full system in his own words, and form your own informed opinion. Links are in the description below.
This documentary is presented for educational purposes only. Nothing in this video constitutes medical advice.
Do not stop or adjust any medication without consulting your doctor. Your health and your life are worth that conversation.